So I think that cosmeceuticals remain an extremely important part of skincare programs. In the United States and North America, where I'm from, it's somewhat neglected a little bit and not emphasized as much as it should be. But every patient that leaves from our office leaves with some type of cosmeceutical regimen, and I'll tell you why in this lecture. So if you look at cosmeceuticals, the indications are listed here. They may be anti-inflammatory, they may be ultraviolet protectants, they treat pigmented stromas. Moisturization is actually the #1, again, effect biologically of any type of cosmeceutical product. And of course, the hot new area is for anti-aging. So if you look at the sites of cosmeceutical action, this is a busy chart, but it's only important to understand that cosmeceuticals are either hydrating agents, anti-inflammatory agents, collagen degradation inhibitors, or collagen stimulators, or they may have some reactive effect on free radical damage. The #1 cause of cell damage, skin cancer, and aging is free radical damage. So that's really the mechanism of action of how all of the cosmeceutical products act. This is the Bible of cosmeceuticals that we help write in the United States. I was also involved in the development of Christian Dior skincare, so I spent a lot of time in the science laboratory in St. John du Bray outside of Paris. And we put together this book with 3 other American dermatologists. The second edition is coming out this month. It goes over the science of all the cosmeceutical products that are out there around the world. So the most important, I'm all about human concepts. The most important concept that I'd like you to take away from this morning is the concept of AM protection and then evening cell turnover, collagen stimulation, and chromophore targeting. So as you can see here, the issues are to protect yourself against ultraviolet radiation. The issues are to protect yourself against ultraviolet irradiation, free radical scavenging, which includes, again, powerful antioxidants, 24-hour hydration, not just hydration that lasts for a few hours, but 24-hour hydration. And then the evening, the goal of any cosmeceutical skincare program is cell modulation, inhibition of the dermal matrix, and then stimulation and remodeling of not only collagen, but also ground substance and elastic tissue as well. And of course, pigment reduction and redness reduction, which we call chromophore targeting. So it's AM protection, evening cell turnover, chromophore targeting, and dermal matrix stimulation. Those are the major concepts of any cosmeceutical program that you give to your patients. Another major advance in cosmeceuticals is the concept of internal-external approaches. Similar to what we talked about with technologies yesterday, the same thing goes for cosmeceutical and the new generation of what we call nutraceuticals, and the newest generation that I'll touch on, which are called trichoceuticals for hair stimulation and prevention of hair loss as well. But inside-outside approaches may be synergistic. So I'd like to talk about 3 different concepts that are major advances in 2019 in cosmeceuticals. That is micellar water, that almost every company is now putting into their cosmeceutical products, peptide stimulation, and the hot area of stem cells. So micellar water are actually small spheres that have a hydrophobic internal component, but they're surrounded by a hydrophilic layer that has 80% water and 25% an extremely mild surfactant. These are the #1 ingredients put in almost all the cosmeceutical products that are used particularly for anyone that has any type of hypersensitivity reaction, such as eczema, dry skin, sensitive skin, etc. This is the hot new area that's being implanted into all the cosmeceutical products into the United States. The second factor are growth factors or stimulatory agents, also including peptides and cytokines. So there are 3 different types of peptides that are produced within cosmeceutical products. There are carrier peptides, which usually have some component of copper or copper sulfate, and the major action of these carrier peptides is to give 24-hour hydration to the skin. Signaling peptides, which act on the PAL-TTKS again pathway, that stimulate all types of collagen, but not only collagen, but also elastin, and another major component of the dermal matrix, which is fibronectin. And the third component, or neurotransmitter, again, peptides, acetylhexapeptide 3, which also stimulate, again, dermal matrix remodeling, as well as increasing hydration of the skin. So the role of these growth factors, peptides, cytokines, and stem cells, is to try to give an even balance between inflammation and anti-inflammation. And the goal that you really want to target are, again, decreased inflammation within the skin. In addition to that, when you decrease inflammation, commonly these types of stimulatory products also induce dermal matrix, increase collagen production, as well as have a potential for hair growth, as I'll talk about in 2 minutes at the end of my lecture. In this study, again, as you can see here, we used a product for 20 patients were studied in this product where we looked at global assessment scale, looking at peptides, multiple peptides in the product, and showed significant improvement in terms of facial wrinkling, not only wrinkling, rite formation, but also skin quality as well. Stem cells, that's sort of the hot new area again. They can be human, animal, or plant-based. And again, they can be a source of cytokine stimulatory factors as well as peptides as well. And they have not only been shown to be stimulators of new collagen, but also anti-inflammatory and free radical scavengers in terms of free radical damage. So we performed a study here looking at the effect of a stem cell serum, as you can see here, after using, again, radiofrequency needling on the skin surface. And it improved, again, the reepithelialization and wound healing by about 50% compared to placebo. Here you can see a stem cell extract that we also studied 3 months after daily usage with increased, again, improvement in overall skin quality and pigment dyschromia. Here's another patient after 3 months using one of our stem cell extracts that we studied, significant improvement in pigmentation, showing it to have strong anti-inflammatory and anti-melanin activity as well in this setting. Antioxidants have been one of the major areas that I've studied in the last several years. Vitamin C remains the #1 antioxidant to look for in a cosmeceutical product. In this study that we published this past year again, we looked at, again, global assessment scale and pigmentation scores as well after 12 weeks in the utilization of this agent, which again had significant vitamin C content in it. There was significant improvement in skin quality and pigmentation. But the #1 antioxidant, I think, in the world is resveratrol. Everybody should be applying resveratrol to their skin, ingesting a little bit of red wine, or ingesting systemic resveratrol. I think it is the #1 antioxidant looking at reactive oxygen species studies. It protects against ultraviolet damage, and like other antioxidants, has strong anti-inflammatory and wound healing action. In this study that we published several years ago, looking at a combination of antioxidants, again, significant improvement in overall skin quality and pigmentation in this setting as well. The retinoids are probably still the #1 cosmeceutical agent. If you're going to look for a product with vitamin A, retinol, or some other retinoic acid derivative, because these are the #1 collagen stimulator, cell turnover agents, as well as anti-inflammatory products. In this study that we published in Dermatologic Surgery this past year, looking at 3% retinol peel for acne, photodamage, and melasma, significant improvement after 4 peels performed at 6-week intervals in terms of pigmentation, bright inflammation, and overall skin quality. This product is now being marketed by L'Oreal throughout the world. Internal approach in the last 2 or 3 minutes. Polypodium leucotomus extract. This is the #1 extract that's utilized. It's called HelioCare in the United States, again, for reactive oxygen species inhibition, photoprotection, and in more recent studies has been shown to prevent the recurrence of melasma in genetically susceptible individuals. There are a number of papers showing all of these qualities. The #1 area scientifically that's been studied and published is in inducing redness from ultraviolet exposure. So it's felt to be utilized in conjunction with the sunscreen as an anti-reactive oxygen species, free radical scavenger, and to decrease potentially the incidence of skin cancer formation. So many dermatologists utilize a combination of sunscreens and polypodium leucotomus extract for their patients to try to have strong cancer potential, anti-aging potential, as well as anti-pigmentation potential in one single product. And lastly, I'd like to talk a little about cosmeceuticals for hair loss, which I call the concept of trichoceuticals. Again, this was published this past year again, showing, and I helped develop Propecia when I was still a resident at Cornell, But the new generation of hair targets is not only 5-alpha reductase, it's also anti-inflammatory, anti-free radical scavenging, and anti-stress components as well. So this product called Nutrafol is the most popular trichoceutical in the United States. You can see on the left there the 4 major components that are in this particular product, and they deal not only with 5-alpha reductase inhibition, which most hair supplements have, but also as anti-inflammatories, anti-stress products, as well as free radical scavengers as well. And again, in 3 published studies in the US using this product, it's been shown to decrease hair shedding, increase anagen or growth formation of hair, as well as increasing hair number and hair thickness as well. So trichoceuticals are actually very popular in North America at this time. Here you can see is monotherapy after 7 months on the left, 3 months on the right, with significant decreased hair shedding and improvement of overall hair quality. So, just to finish this lecture, I'd like to talk about some of the newer trends in cosmetic usage and antioxidants. Number 1 is we now have nano delivery systems that allow increased penetration of products through the epidermal barrier to get into the dermal matrix target where you want these products to act. We're also using energy-based systems. This is the Viva, the Venus companies out there, or any type of needling or fractional radiofrequency device that allows transepidermal delivery of cosmeceuticals, what I call the so-called targeted approach to skincare. And then this is something that we're studying that's brand new, hot off the press, and these are exosomes. These exosomes are sort of the next generation of lysosomes. They're extremely small micromembrane type vesicles. Many different cell types excrete them, and these are felt to increase the penetration over 100 times of that of lysosomes to be a very effective target for, again, treatment using topical cosmeceutical agents where you want effective, again, penetration into the dermal matrix. So look out for more of this. You're going to be hearing a lot more of exosomes in the next couple of years. So in conclusion, we have cosmeceuticals, peptides, stem cell extracts. Remember micellar water. Look for that in any cosmeceutical agent that you're looking to treat a patient with sensitive skin. There's an increased amount of evidence. I'm the co-editor of the Journal of Cosmetic Dermatology. There are many more peer-reviewed, again, placebo-based studies that are now out there. Remember the concept that I talked about, AM protection, PM cell turnover, chromophore targeting, and collagen stimulation. Again, this really is a paradigm you should be thinking of for all of your patients. Then internal, external approaches with skincare topical products, cosmeceuticals, trichoceuticals, nutraceuticals together may have synergistic additive effects. And we have new generation delivery systems. We have liposomes. We now have transepidermal delivery of cosmeceuticals through energy devices, and exosomes are the next great frontier for cosmeceutical delivery. Thank you very much.